Hello! Many parents and kids are scared when take the X-ray shooting. Michael and his dad have the same problem here.
I'm 8 years old. My friends laugh at my teeth when I smile, even though they don't want to play with me anymore. I'm so sad.
They are worried when dentists said Michael needed to take an X-ray shooting. They have the concern about following questions. Why should I take the X-ray shooting? Is there any radiation during the process? How to protect myself from radiation? Taking X-ray shooting is one of the most important procedures during the treatment. Normal oral inspection can only check the surface of the teeth. However, the X-ray would help dentists to find out what's problem with inside teeth and alveolar bones. X-ray radiation is one of the ionizing radiation. According to the recommendation of ICRP, limiting value of a single person per year is 5 millisievert, equals 5,000 microsievert. Intra-oral film, panoramic, cephalometric, and CBCT are very common in oral clinical inspection. The dentist will decide to take which type of the X-ray shooting based on the comprehensive status of the patient. Intra-oral film is normally used on the inspection of 1 or 2 teeth. The radiation is the lowest but require obedience of the children. Panoramic is normally used on the inspection of whole mouth and jaw. The radiation is a little higher than intraoral film. It is like taking a family photo of the teeth. Cephalometric is mostly used on the inspection of maxillofacial bones. The radiation is almost the same as panoramic, but with limited requirements of obedience of children. CBCT is able to inspect teeth from 3 dimensions, but the radiation is a little higher than others, which means it needs to be selected according to clinical indications. So, how much radiation we take in daily life? We are very familiar with banana. It is rich with potassium, and about 0.0117% of natural potassium is radioactive potassium, potassium 40. Research shows that the radiation we took eating 1 banana is 0.1 microsievert. So how much radiation we take exactly during the intraoral film shooting? Normally, the radiation for taking 1 intraoral film is 4 to 5 microsievert, which is the equivalent of being exposed to several bundles of bananas. The radiation we took for 1 panoramic is about 3.85 to 30 microsievert, equals to 1 to 6 intraoral films, equals 38 to 300 bananas. The radiation from dental X-ray is not much. And before the procedure, children will wear protective equipment to limit the effect to minimum, so the parents can feel assured when children take X-ray under proper protection by the requirements of the dentist. Now, let us see how a little kid takes X-rays bravely like an astronaut. The adventure for a little astronaut. Hi! Today, we need to take panoramic and cephalometric shootings. Don't run around. Parents will lead you to the triage desk first. When your name was called, you may come inside and ask parents to confirm your name and shooting area first. Must put protection equipment on before the shooting. It is heavy, but it will protect your body like the astronaut needs to wear spacesuit in space. Parents could accompany kids with wearing the same protection equipment for X-ray shooting. Aha! LargeV CBCT. Looks like a spaceship. You have to follow the nurse's instructions. That makes sure your spaceship flies smoothly. Here is key step. help you to adjust the right position. You need to hold the handrail, bite the stick, and stand still. You may close your eyes when shooting begins. The camera will go around you like a satellite, so we can have a photo of your teeth. This big guy is for cephalometric. You need to stand under it and put a hat on you with an earplug. Listen to the instructions. Stand still and look forward. Do not look down or look up. Occlusion of teeth naturally. Do not move. The machine around you will fly over like a spaceship. Okay, all done. Isn't it fun? We take pictures of teeth like we're traveling through space. Now, let your parents to print your teeth photos out.